Your thyroid is a small gland in your neck. It is shaped like a butterfly. This gland makes important hormones. These hormones control your body's energy use and temperature. They are vital for good health. The thyroid plays a key role in how your body works every single day. If it's not working right, many things can be affected. Cancer occurs when body cells grow abnormally. They do not follow the normal rules for cell growth. These cells divide too fast and without any proper order. Often they form a lump called a tumor. This tumor can then affect how nearby organs and tissues function. Understanding this basic process helps to understand what cancer is. Medullary thyroid cancer, or MTC, is a rare type of thyroid cancer. It starts in specific cells of the thyroid gland. These cells are known as C cells, or parafollicular cells. The main job of these C cells is to produce a hormone called calcitonin. Calcitonin helps control calcium levels in your blood. MTC arises when these C cells become cancerous. MTC can happen in two main ways. Most often it is sporadic, meaning it occurs by chance in individuals. In these cases, there is no family link or history of the disease. Sometimes, however, MTC is familial, meaning it is inherited from a parent. This familial type is passed down in families through specific changes in genes. Knowing the type can influence treatment. The prognosis for medullary thyroid cancer means the likely outcome of the illness. It also suggests the chances for recovery from the disease. The outlook for MTC can vary for each person. Several different factors can significantly influence this prognosis. Doctors consider all these factors to give the best possible information to their patients. A person's age at the time of diagnosis is an important factor. Generally, younger patients tend to have a better prognosis. Their bodies might handle the necessary treatments more easily and recover faster. Older individuals, especially those with other health conditions, may face more challenges with the disease itself and its comprehensive treatment plan. This is a common consideration in many cancers. The cancer's stage at diagnosis is very crucial for determining the prognosis. Staging describes how large the cancer is and how far it has spread from the thyroid. MTC that is found early, when it is small and confined only to the thyroid gland, generally has a much better outlook. Advanced MTC that has spread to lymph nodes or distant organs is more serious and harder to treat. Genetic factors also play a significant role in the MTC prognosis. Many instances of familial MTC are linked to specific mutations in a gene called the RET proto-oncogene. Understanding these particular genetic changes helps doctors to better predict how the cancer might behave over time. It can also guide specific treatment strategies, leading to more personalized and potentially effective care for the patient. Surgery is the main and most important treatment for medullary thyroid cancer. The primary goal of the surgical procedure is to remove the whole thyroid gland. This operation is technically called a total thyroidectomy. Often, surgeons might also decide to remove nearby lymph nodes in the neck area. This is done if there is a concern that the cancer might have spread to these nodes. Radiation therapy is another potential treatment option for MTC. This therapy uses high-energy rays, similar to X-rays, to target and kill cancer cells. It can also effectively stop these harmful cells from growing and dividing. Radiation is sometimes used after the initial surgery. This helps to treat any microscopic cancer cells that might remain, or if the cancer has spread to other areas. Targeted therapy drugs represent a newer and more modern treatment approach for MTC. These specialized medicines work by precisely identifying and attacking specific molecular parts of the cancer cells. They are frequently used for cases of advanced MTC. This typically means MTC that has spread to distant parts of the body and where surgery alone is not enough to control the disease. Traditional chemotherapy, which uses strong drugs to kill fast-growing cells, is not usually very effective against most types of medullary thyroid cancer. Therefore, it is seldom the first choice of treatment recommended by doctors for this particular cancer. After treatment, doctors will closely monitor blood levels of calcitonin and CEA. These substances are tumor markers that can indicate if MTC has returned or is still present. Finding medullary thyroid cancer early is absolutely crucial for achieving a good outcome. When the cancer is detected at an early stage of its development, treatment is often much more successful. This significantly improves the chances of completely curing the cancer. It might also mean that the treatments required are less intensive and have fewer side effects for the patient. How can MTC be found early? It is important to pay attention to your body and watch for any unusual signs. A common sign is a lump or swelling in the front of the neck. Other clues can include persistent voice changes, hoarseness, or new difficulty with swallowing. Regular doctor visits and checkups are also very important. They can help find such problems before they grow more serious or spread. For families who have a known history of familial medullary thyroid cancer, genetic tests are vital. This specialized testing can identify individuals who have inherited the changed RET gene. People carrying this specific gene mutation are at a very high risk of developing MTC. They might choose to have preventive surgery to remove their thyroid gland. This can be done even before any cancer actually starts to develop. After any treatment for MTC, regular and consistent follow-up care is very important. This typically involves scheduled doctor visits, physical examinations, and specific blood tests. These checkups are designed to help find any potential return of the cancer as quickly as possible. Working closely with your dedicated medical team offers the very best chance for long-term health and overall well-being following an MTC diagnosis.